Okay, so you got your MRI or your imaging and you come into PT. Now what? Well, let's think about this. In a previous video, I talked about what does PT do? And our job is to ultimately help people restore their function. And we hope that that also comes with a decrease in pain and an increase in your body's abilities to perform certain tasks and ultimately building your capacity so that you can do more. Even if it's just more everyday stuff, let alone more performance stuff. But again, our job is to restore function. A lot of times if people have pain, whether it's like shoulder pain, neck pain, back pain, whatever it might be, and then they go to see a doctor or an orthopedist or a specialist, they're gonna get some imaging because that's just, they want to take a look, and that's great. I don't think there's necessarily any problem with that. But it is if somebody gets too attached to what that diagnosis is. Oh, I got a bad disc in my back. It's like, okay. It's good to know. I'm going to take a look at you and try to see what can and can't you do. And knowing that, what you have on that diagnosis, I hope fits your picture in the clinical sense of diagnosis, or our clinical working model, if that makes sense. So they should kind of match up. In the same sense, if somebody is having some sort of issue and we go, yeah, it sounds like a disc or something, or it sounds like a rotator cuff tear, those MRIs should be really confirming. They shouldn't come out of left field oh wow, I didn't know that was there. No, that's our job. That's what we do. We should be able to tell you what's going to be on that MRI. I don't want to make it too much about well, what's that diagnosis? It's more well, what can and can't you do? And based on all the things that you're telling me in your clinical picture, I should be able to treat you to decrease some symptoms and increase your functional capacities and tolerances. That being said, even if you come in and you got this MRI with let's say it's a disc, let's go with that, and you can't do all these things, and then we work with you and you do really well and you're even back to doing all the things and all your symptoms are gone or mostly gone, you had another MRI, it might actually look exactly the same. So then you go, well, gosh, that doesn't make any sense. And just because we have symptoms and just because we have something that's on an imaging doesn't 100% mean that it's because of that disc. It's a lot of times the dysfunction that goes along with the whole picture. Because what they used to do is just oh, I have back pain, do an MRI, if they find a disc, it's well, that correlates, let's get some treatment for that. But they've been doing a bunch of research now that they're taking MRIs of people that have zero symptoms, asymptomatic, no symptoms. They do this all over the body. And they're finding that a lot of these diagnoses and findings are super common in people that have zero complaints and zero history of complaints. So some of this stuff is just there. It's whether or not it's pissed off, to be honest. If it's painful and it's aggravated, then it's going to throw some symptoms at you. So we have to figure out, we being the clinicians and in partnership with our patients, well, how do we get this thing to resolve? And how do we get you to have less pain? And how do we get you to have more function? The MRI can be a really good tool, but let's not let it be the guiding light for everything. We're going to find a myriad of impairments and findings with every person. If it smells like a disc and acts like a disc, let's treat it like a disc. It'll probably get better. And if it does, then we're good. We're fine. Let's not get too hung up on what the imaging says, because that imaging might actually not change even if your symptoms improve. And I know that might be totally the first time you've ever heard that, or might be blowing your mind right now, but that's really what it is. I'm a 41-year-old male, that's been very active my whole life. I'm sure I got all kinds of stuff that I don't have any MRI evidence for, but statistically I should have all kinds of stuff. So as long as my symptoms, should I have some, are low and I can function really high, it's not really an issue. I don't want to get hung up on oh man, what did my MRI say? It's well, if I'm functioning, let's just go with function. And if I can do more, then great. There certainly are times when MRIs are warranted because the rehab's not progressing, we can't change these symptoms, and yes, you have to go to a specialist, you have to get that injection, or you have to get a surgery or something like that. I'm not going to say that we fix everything, because sometimes things just can't get fixed. But I will say that a lot of stuff, given the opportunity to heal and to be progressed through a rehab process with a trained professional like we are, people can do really, really well. So you got your MRI, don't let that be your only thing the thing that you anchor to. Again, our goal is not okay, you have a disc. Our goal is I want you to improve function and get back to doing the stuff that you want to do. So let's use that MRI or that imaging as information as part of your clinical picture, and the goal is the same.